Missouri is now the 38th state in the nation to expand Medicaid to low-income residents as part of the Affordable Care Act. It has been over a year since voters approved it, and after many delays, the first few thousand people enrolled this month. In a moment, Lisa Desjardins will talk about the rollout, but we begin by hearing from a few people who are now eligible for Medicaid about the long wait and the urgent need for coverage.
My name is Nina Canaleo, and I live in Kansas City, Missouri, and I work nights as a janitor.
My name is Autumn Stoltz. I live in Springfield, Missouri. I work through Cox Health at Home to do stay-at-home care for my mother who is disabled.
My name is Terrence Wise, and I'm a McDonald's worker from Kansas City, Missouri.
My name is Amanda Reynolds. I live in St. Louis, Missouri.
I just received the healthcare coverage through Medicaid expansion. In fact, it came in on Friday. I kind of did a little happy dance.
Right now, I currently have no healthcare coverage or benefits. I've recently applied for Medicaid, and I'm waiting on a response on my eligibility.
They said I made too much money, and I made $18,000 a year. I'm not sure how that's too much money because I can't even rent my own apartment. Now I do qualify.
Once it hit the ballot and people put it through, it should automatically been implemented. We should not have to fight our government to get what should have been given to us all along as a safety net.
I'm a longtime cancer patient. I've had cancer off and on since 5 years old. So I've had 6 different forms of cancer. And as of last week, I just had surgery number 29. And when you don't have insurance, and you've lived a life of cancer, even if you haven't lived a life of cancer, you're thinking, have I waited too long? Is it something that I'm not getting seen? Am I going to be able to catch it in time?
I'm 42 years old now, and the last time I visited a doctor, I was 18 years old. So it's been over 2 decades, and it's almost unimaginable to think that any human would go 365 days out of a year without being sick or having some healthcare problems.
I have multiple sclerosis. T cells attack your spinal cord and your brain, and it leaves me numb. There's a lot of people who can't walk, and you have to have MRIs every year. It's not cheap.
Now I am a Medicaid client. And the first thing the doctor says to me is, that opens a whole new world for you in getting care. So it was like major relief.
I actually lost somebody very dear to me back in February. She's my sister. And if she had the medical coverage all along when she first started getting sick, she wouldn't have passed on this year. And it took forever for her to be on Medicaid. The cancer and the bacteria infection that took her, it was absolutely horrific. And individuals like that is the reason why I fought so hard.
Those are 4 of the 275,000 people now eligible for Medicaid in Missouri. Under the new rules, anyone making up to 138% of the poverty level, that's about $30,000 for a family of 3, can qualify. Previously, that was just $4,600 at the qualifying level. And individuals largely could not qualify at all, only people in families or pregnant women by and large. To tell us more, I'm joined by Jason Rosenbaum, politics correspondent for St. Louis Public Radio. Jason, we just heard from those 4 people. I know you've spoken with some of them as well. Even with this expansion, this is still at an income level below full-time minimum wage work. How do you see, and what are you hearing about who this expansion helps and how?
Primarily, this is going to help what is colloquially known as the working poor in Missouri. And you're right, these are people that make sometimes below like $15 an hour, well below $15 an hour, but people that previously made too much money to qualify for this healthcare program. Missouri had one of the lowest eligibility rates in the entire country. There were some situations where a single mother or single father of one kid, if they made more than $4,000 a year, they couldn't qualify even though their child could. So this is going to be a real lifeline for people like the folks you talk to, some of whom I've also talked to, who have really serious health problems and are now going to be incentivized to go to the doctor and get them at least dealt with before they have to go to the emergency room.
It really strikes me that Missouri voters, including some Trump voters, firmly backed this when they went to the polls. Why is it that Republicans have been fighting so hard to try and block it?
This has been a philosophical hill to die on for Missouri Republicans since at least 2005. That's the year that then Governor Matt Blunt and the legislature made deep cuts to eligibility. And even after Missourians elected a Democratic governor in Jay Nixon in 2008, he was unsuccessful at raising eligibility even after the Affordable Care Act passed and the federal government was going to pay for all or the vast majority of Medicaid expansion. But what really tipped the balance in 2020 was that hospitals in Missouri just were fed up with the situation. And while Medicaid expansion is not going to completely get rid of the problem of uncompensated care, hospitals had been struggling to treat people that don't have healthcare coverage, especially in rural Missouri. So they primarily funded the 2020 ballot initiative. And the pro side ran a very robust, a very well-funded campaign that had slick television ads up against an opposition of mainly Republicans that didn't have basically anything.
I know those supporting this expansion have also gotten help from the $1 billion almost from the American Rescue Plan that's now going to be coming into the state. But I'm curious, so far it looks like just a few thousand folks have signed up for this expanded Medicaid. Do we know why so few?
I think it's probably because a lot of people who would qualify for Medicaid don't have easy access to computers or phones like we do. If you're making $10,000 a year, you may not be able to access the information that you even know that Medicaid expansion is here. So it's really going to fall on social service organizations that primarily deal with Medicaid patients to reach out to some of these hard to reach communities, especially in rural Missouri, which doesn't have good internet access at all, where you could find potentially thousands of people that could benefit from Medicaid expansion and get the word out that this is available to them. This is still a Republican state with a Republican governorship and a Republican legislature. The chances that the state is going to widely promote the fact that Medicaid expansion is here is frankly not very high.
Healthcare is such an important topic. Jason Rosenbaum, St. Louis Public Radio, thank you for joining us.
Thank you.